I call this the age of discovery. Very early in the AIDS epidemic, one of my colleagues, Dr. Mark Stoller, who was a pathologist at Strong, made a discovery. I knew Stoller from years before because when I first started my career at the medical center, I worked in the University Health Service and had a lot of medical students who were my patients, and Mark was one of them. And then he graduated, became an MD, did a pathology residency, and then joined the faculty. So now we were colleagues, and we were sort of thrown together in terms of he was the person who was able to diagnose this pneumocystis pneumonia, which was the very common pneumonia of AIDS in those days. But the process took a long time. We had to do an invasive kind of procedure with what they call bronchoscopy, which involves a tube into the lung and snip out a piece of lung to get a biopsy, and then wait 2 to 3 days for the specimen to be prepared so that you could look at it under the microscope and make a diagnosis. So it was this long, involved process. In the meantime, we were treating patients, some of them unnecessarily, with a pretty strong drug, and wanted to try and do it better. So a lot of the time we spent in his office in the dark, usually around 4 o'clock every day, going through slides, talking about patients, and also grousing about how this process just takes so long. And I kept prodding him and poking him. Well, why don't you do something about it? Figure this out. You understand this, so you do it. And about 6 months later, he did. He showed me what he had discovered, along with a couple other medical center people, about how you could do the same thing with cough sputum. Just have the patient cough into a cup and be able to stain it and read it right there in hours. What had taken days now became possible in a matter of hours. What a brilliant guy. He was like my medical student, became my mentor. And last we talked, he was at the University of Virginia, working his magic and doing good work as well. But I'll tell you, that kind of discovery came out of the necessity we just need to do this better, because we were constantly dealing with things that had never been dealt before, answering questions that nobody had ever answered, and trying to figure this out. It was like building the car as we went down the road. He accepted the challenge, collaborated with some people in the medical center, and did it, and made a huge difference in terms of how we were able to treat patients quickly, appropriately, get better faster, no delays, none of it. Thank you, Dr. Stoller. Good job.